Thanks very much once more for inviting me. I did come along to one of your founding meetings in December, and in addition to being the Huddersfield Unison Health Secretary, I'm also proud to say I'm Treasurer of Calderdale Save Our Services, and I bring fraternal greetings from our organisation to yours as well. Can I start off by registering an interest? Now, the interest is I'm employed by the local Calderdale and Huddersfield NHS Foundation Trust. That's a hell of a mouthful to get out, but that's the title that we have now. I concur with much of what Bob said. The NHS is not a perfect organism. It never could be, and it never will be. But it's by far and away the greatest health provision system in any country in this world. And I stand by that. I am passionate about the NHS, and I will always be passionate about the NHS. And I want to just go back a little bit in time. I'm conscious of the 10 minutes aspect, but I think I might steal some of Linda's extra 5 that might have been there. I just want us to go back a little time. 63 years ago, there was no NHS. Now that might seem astounding to the vast majority of this audience. My father is 83 years old. He was 20 when the NHS came into being. He was one of 7 siblings in a working class family in Dundee. 3 of his siblings died in infancy. Partly because of the nature of illness, partly because over the years there's been great advances scientifically and pharmaceutically in terms of treatments and diagnosis, and that's great. But partly because of lack of access to proper health care. Because prior to the introduction of the NHS, we had a situation where you had to pay for services. If you needed to call a doctor out to the house, and you did get doctors coming out to houses at that time, you had to pay. If you had to go to the hospital, you had to pay. Now, it's very difficult for most of my generation, and in fact like my son's generation, to understand exactly what the impact of that is. It's my sincere, utter belief that the introduction of the NHS in 1948 by the then Labour government was the greatest social advance this country has seen. I think it's a mark of any civilised society that you invest in the people, and the 2 greatest investments you can make are in health and education. And you cut on them, or you pay scant attention to them at your peril and the peril of the future of the nation. But I'm going to talk a bit more in detail about the actual legislation that's been proposed. Andrew Lansley, the current Health Secretary, was almost unique in coming to the role, because for 5 years prior to last year's election, he was the Shadow Secretary of Health. That had never really happened before. And only 10 weeks into the government, post the coalition post-election agreements that came out, he presented a white paper, the Health and Social Care Bill, itemised or subtitled Liberating the NHS. I would go so far as to say, rather than say liberating the NHS, it's more like eviscerating the NHS or privatising the NHS. And I hope to go on and explain a little bit more about why I take that view. Sir David Nicholson, who's currently the Chief Executive of the NHS and already has been appointed to be the Chief Executive of the National Commissioning Board, which is going to replace a lot of the Department of Health responsibilities. And I've been told, by the way, that when he was a young man, he was in Huddersfield, and he was quite off the left. But I'm not sure if that's evident by the way he acts today. But he's actually said that these changes, and as was said, they were not in the manifesto of the Lib Dems, they were not in the manifesto of the Tories, that these are the biggest changes that the NHS has seen since its inception. And David Nicholson came up with a phrase which I loved. He said, these changes are so big they can be seen from space, like the Great Wall of China. It sounds stupid, but it is the case. Basically, the primary care trusts, the strategic health authorities are all going to be abolished. And they're going to be abolished within 2 to 3 years' time from now. GP consortia are going to do the commissioning. Now, it might be as well just to take a second or so just to explain what this means by commissioning and providing. Because there is an artificial internal market within the National Health Service. It didn't used to be, but in the, I can't remember if it was the late 80s or early 90s, the then Conservative government introduced an internal market, and there was a split of those that commission services from other parts of the NHS and those parts of the NHS that provide the services. Not just hospitals, there are many other aspects like community health centres and so on, community teams of workers still employed by the Primary Care Trust. But there was this artificial market in place, commissioners and providers. Now essentially the commissioning aspect of it and the planning side of it is being abolished. The commissioning then, that's the purchasing of healthcare from the providers, which is generally in the NHS, our District General and larger hospitals, is going to be done by GP consortia. Now the GPs are people that you and I trust. You go to your GP, you seek advice, you want a diagnosis, you want counsel as to what's next best to treat you. And there's a big element of trust in that. We tend to all know our doctors, and that's a good thing. There's continuing aspect of knowledge of care, continuing knowledge about the type of lifestyle you have. You're not a stranger to your GP. Well, for those of us who have to visit them on a regular basis anyway, excuse me. GPs are employed, and you go to your GP because they do these things. GPs are not accountants. They're not business strategists. They're not there with the expertise and knowledge about commissioning care. They know about referring you, for example, to a gynaecologist like Bob Hayes at the hospital, and that's good. But when they've now got the duty of commissioning all the care, and we're talking 80 billions worth of NHS spend, they can't do that, not at the same time as treat patients. So they're going to have to buy in the expertise. Now, best case scenario is that after spending a lot of money giving redundancy cash to the PCT staff who are expert in commissioning, they re-employ them then to do that for them. Worst case scenario, and it's already been referred to, they actually bring in United Healthcare, Virgin Healthcare, and the myriad of countless, very experienced in the private health industry around the world, private, for-profit companies who will come in and say, we will do this for you. Now the next aspect I want to talk about in terms of GP consortia is accountability. And this is very important. The primary care trusts were not perfect organisations, but they were accountable to you and I. They had public meetings, they published agendas, they published their plans, they published their finances. You could attend the meetings, you can go and lobby, as I did last year, to try and avoid 1,300 staff in NHS Kirklees being privatised into a social enterprise. We failed in that task, but at least we had the access and we knew what the plans were, and you as members of the public could go in, sit in the meetings and be heard. In the legislation, in the detail of the legislation, the GP consortia don't even have to have a board. They don't have to publish their plans. They don't have to have public meetings. They don't have to say what we're going to do. You'll find out once the decision's been made what is actually going to happen there. In addition to that, GP consortia also have the power to decide which services are actually appropriate to be provided.